the histamine pathway is directly linked with a increased histamine, increased pro-cancer risk, and cancer pathways. Boom.
Now, Melissa, you graduated the program 2 years ago. So this
Yes.
is really checking back in with you. This isn't a recent graduation that you're able to share with us. You're able to tell us how's it going down the road. So why don't you just introduce yourself, Melissa?
Yeah, so I'm Melissa. I finished the program a little over 2 years ago, almost 2.5 years. And before coming to the program, life was just not good. I did have a couple of diagnoses, but had a laundry list of other symptoms that were just debilitating and was not getting anywhere as far as the medical care I needed or, any help to resolve any of my issues.
Okay, so let's talk about the specifics. What were the symptoms you were dealing with?
The biggest for me was the pain, and probably the most dangerous was the weight loss. I did lose about 30 pounds in approximately 3 weeks. The
Scary.
pain was debilitating. Couldn't function. I didn't want to function because I couldn't.
Tell me the level of pain that we're talking about.
The level of pain was a 10 plus. I
10
mean,
plus, off the charts.
I hurt in my joints, in my back, in my muscles, cramps everywhere. It was awful.
Unbearable. And the fatigue was so much so that hard to get out of bed in the morning, or what?
It was hard to get out of bed. It was hard to move. I could walk, from my great room to my kitchen and back, and I'm exhausted. That was my exercise for the day.
Okay.
So
And then,
it was bad. Digestion was a problem. I had bloating. I had nausea. Certain foods I would eat, that foods that you thought, okay, this is a safe food to eat. This should
mhm.
be something fairly digestible, fairly easy on your system, and then it wouldn't be.
Nope.
Um, I had awful insomnia. And then if you don't sleep, your body doesn't, heal, and you literally can't function.
Melissa, you represent the average case. And I want anybody who's watching right now, if any of what Melissa said resonated with you and you're like, that's me, or I have those symptoms, type it in chat and let's share this as a community to realize just how common these problems really are. Hi, I'm Maggie UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
Right. Because, like Julie is saying, she can totally relate. She
Mhm.
felt like this was how she was going to live or die for the rest of her life as
I
well.
thought that. Hey, guys, I was Melissa. At the
Right.
age of 36, Melissa, I was you. I mean, our stories actually mirror each other quite a bit. So, number one, this is a common pattern, and there's many of you out there with very similar patterns like this. But what I'm going to share with you guys is that even as a doctor myself, going through a very similar journey as Melissa, I went through the same roadblocks. And the search for diagnosis never ended. And it was year after year after year after year. And even my colleagues were telling me, it's all in your head. Your hormones are fine. They don't need to be tested. Or no, you're not really having allergies to food. No, why would you need those numbers tested for your thyroid? I was met with those resistance, right? I really do see patterns. And when I hear Melissa's story, and it could be any of your story, I could pull any of you live right out of the audience right now, and I can already tell you how you're going to solve your problem. Because right when I listened to Melissa's story, a couple things really hit me. One of the things that hit me was she talked about a lot of digestive issues and inability to gain weight. And I don't know how many of you have digestive issues, and either you can't lose or you can't gain weight. Immediately in my head, I knew that there was going to be a major digestion issue for her. Major digestion issue for her. And I can tell you right now, not only as a medical doctor, but as a functional medicine provider, 99% of doctors and even functional and natural doctors are not trained to evaluate and look for signs of digestion disorders, which is a root cause of a lot of these issues. First of all, and I'm just thinking about the digestion issues, heartburn, diarrhea, gas, bloating, those kinds of things. But at the same time, downstream, what kind of other symptoms are they causing? Well, it's causing her not to be able to make and break down and process her hormones. There's going to be hormone problems. It can lead to also malabsorption problems that can lead to what? Inability to absorb iron, which can cause what? Hair loss and depression. And she mentioned that she had problem with dizziness. She had some tinnitus. She had been diagnosed with a vestibular balance disorder. And guess what? people are prone to those when they don't digest and absorb proper minerals like calcium, magnesium, and zinc or potassium. So digestion is a root cause. I don't care what other downstream, I do care, but it doesn't matter what downstream diagnosis you have. It comes back to ding, 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 ding. That's a root cause.
Mhm.
And Melissa, did you find out during the program that was a major root cause for you, digestion?
Oh yeah, absolutely. The gut, my gut was a source of a lot of things. And once I healed my gut and got my digestion, I did start to gain weight. I've maintained a weight for 2 years now. I gained every bit of what I lost back plus a little.
Because digestion is linked to mast cell, it's linked to POTS, it's linked to insomnia, it's linked to pain, it's linked to hormones. So that's just one thing. First pattern I saw was digestion, right? And then I start thinking, what's another pattern? Well, she mentioned she had thyroid nodules,
Mhm.
right?
Yeah.
Oh yeah, I've had them for years. My previous primary care provider, I had told her about them, and she's like, "Oh, they're small. They're benign, so we don't need to
Problem.
worry about them anymore." And
Problem.
even then, I was kind of like,
Didn't
"Well, I
seem right.
wasn't born with them, so they probably shouldn't be there." you
So
know.
this is another pillar is hormone balancing for us, which is for me, like, this is a really big pattern that was missed in Melissa and missed in so many of you. How many of you said you had thyroid goiters, nodules, cysts, or symptoms of low thyroid, yet you've been told nothing is wrong or your labs are fine or your thyroid medication dose is fine? How many of you have been in that group? Providers, medical and functional naturopathic providers just aren't trained on the fact that these abnormal thyroid findings like the goiters, nodules, and cysts is 100% a sign of autoimmune disease of the thyroid. Boom, write that down.
That's a big thing to take in, and that's what you learned, Melissa, as well.
I didn't know that at the time. I knew it was abnormal for them to be there, but then when I started the training, you started learning everything, I was like, I knew something was going on. So, yeah, I mean, it was a big eye opener.
Huge eye opener. All of these, what we call pro-inflammatory pathways, which activates what we call inflammatory cytokinins that causes activation of hormone problems, things that go into the brain and affect mood and energy in her brain cells and in the rest of her body. It can trigger pain. The other pathway it activates is the histamine pathway. Histamine pathway. And so many of you guys don't even realize that the histamine pathway isn't just linked to allergies, but it's linked to pain. It's also linked to being pro-cancer. How many are you struggling with cancer, precancer, or have had a history of cancer and don't realize, oh, wow, food allergies and the histamine pathway have something to do with this? Absolutely, it does. And it's a hidden pattern nobody's seeing.
To me, that's a light bulb moment to hear, anybody struggling or getting precancerous results, even that
Mhm.
this is connected to that. I've never heard this anywhere else.
That actually it was kind of an aha moment that you mentioned that too, because I had a breast biopsy and it was benign, but I had cell changes.
Yeah.
So it was considered, precancer. So yeah,
High histamine pathway in Melissa, food allergies. This is scientific fact. I'm not making this up. If you actually look at the medical literature, if you look at understanding the biochemistry of the histamine pathway, you even see diagrams of all the things that histamine does. It's not just allergies, people. The histamine pathway is directly linked with a increased histamine, increased pro-cancer risk, and cancer pathways. Boom.
Nobody's talking about this.
Mhm.
The research is there, but I'm not hearing that from my doctor. I've never ever heard that before. So
Well,
thank you
I
so
see
much.
patterns. I
Like
see patterns.
she sees patterns. So I see dead people. She sees
I
patterns.
see pattern.
I see thriving, living, passionate, living life people that kick ass, take names, and chew bubble gum.
We love to hear it.
Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire. And that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.